Changing context of social work practice and social work practice in various settings. Changing context of social work practice. 1. Technological advancements. Increased use of digital tools, teletherapy, and online case management systems. Ethical concerns around data privacy and digital inclusion. Use of artificial intelligence, AI, in social work assessments. 2. Policy and legislative changes. Changes in welfare policies and funding allocations impact service delivery. New laws addressing mental health, child protection, and domestic violence. Immigration policies influencing refugee and migrant support services. 3. Demographic and social shifts. Aging populations require more geriatric social work services. Increased diversity necessitates culturally competent practice. Rising inequality and homelessness call for stronger advocacy efforts. 4. Globalization and migration. More social workers are dealing with issues related to refugees, asylum seekers, and displaced populations. Cross-border collaborations between social work agencies. 5. Mental health and well-being. Greater recognition of mental health as a crucial area of social work. Expansion of trauma-informed care and holistic approaches. 6. Environmental and climate change concerns. Growth of eco-social work focusing on disaster response and environmental justice. Social workers helping communities affected by climate change. 7. Community and grassroots movements. More focus on community-based interventions and participatory approaches. Empowerment models gaining prominence over traditional charity-based approaches. 8. Economic and employment challenges. Economic downturns increase the demand for social services. Job insecurity and the gig economy impact social welfare policies. 9. Intersectionality and social justice. A stronger focus on anti-oppressive and decolonized social work practices. Increased emphasis on gender, race, and LGBTQ+ rights within the profession. Social work practice in various settings. 1. Healthcare settings. Hospitals and clinics, assisting patients with discharge planning, crisis intervention, and access to healthcare resources. Mental health facilities, providing therapy, case management, and support for individuals with mental health conditions. Palliative and hospice care, supporting patients and families facing end-of-life issues. Substance abuse treatment centers, helping individuals recover from addiction through counseling and rehabilitation services. 2. Child welfare and family services. Child protection services, CPS investigating abuse and neglect cases, providing foster care placement, and ensuring child safety. Adoption and foster care agencies, supporting children in need of permanent homes. Family counseling centers, strengthening family relationships and resolving conflicts through therapy and intervention. 3. School and educational settings. Public and private schools, addressing behavioral issues, providing counseling, and advocating for students' rights. Special education services, assisting children with disabilities and ensuring access to appropriate resources. College and university counseling centers, offering mental health support and academic guidance for students. 4. Community and social services. Non-profit organizations, implementing programs for poverty alleviation, homelessness, and food security. Community development programs, empowering marginalized communities through skills training and advocacy. Youth and elderly services, organizing recreational and support programs for different age groups. 5. Criminal justice and legal settings. Correctional facilities, providing rehabilitation programs and reintegration support for inmates. Juvenile justice programs, assisting at-risk youth with behavioral interventions and alternative sentencing programs. Victim support services, offering crisis intervention, legal advocacy, and emotional support to crime victims. 6. Corporate and workplace settings. Employee assistance programs, EAPs providing counseling and wellness programs to employees. Human Resources, HR, departments, promoting diversity, equity, and inclusion in workplace policies. Workplace mental health initiatives, supporting employees' emotional well-being and work-life balance. 7. Military and Veteran Services. Veterans Affairs, VA assisting veterans with mental health support, housing, and employment services. Active duty military support, helping military personnel and their families cope with stress, trauma, and deployment-related challenges. 8. Geriatric and Aging Services. Nursing homes and assisted living, supporting elderly residents with social and emotional care. Aging advocacy organizations, helping older adults access healthcare, housing, and financial support. Home-based social work, assisting seniors in maintaining independence through in-home care and resources. 9. Disaster response and crisis intervention. Emergency relief organizations, providing immediate support during natural disasters and crises. Crisis hotlines and suicide prevention centers, offering emergency counseling and mental health support. Humanitarian aid organizations, working with displaced populations in war zones and disaster-affected areas. 10. Research, policy, and advocacy. Social policy and advocacy organizations, lobbying for policy changes in social justice, welfare, and human rights. Academic institutions and research centers, conducting studies to improve social work practices. Government social services, designing and implementing welfare programs for communities in need. Thank you so much for watching this video. Please like, share, and subscribe this channel. See you in next video.